Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. Today, I'm going to go over a little bit of the risks and the expectations for a laparoscopic surgery. And these are just general educational guidelines to help you for surgeries like tubal sterilization, so laparoscopic salpingectomy, removing the tubes, or laparoscopic tubal ligation, tying your tubes, or laparoscopy, a diagnostic laparoscopy for chronic pelvic pain, or looking for pelvic adhesions, or something called endometriosis that causes chronic pelvic pain, or potentially for a cyst in your ovary or removing one or both ovaries. General guidelines, again, this is kind of a educational base to allow you to ask more pertinent questions to your physician and to have some expectation after the surgery. So all surgeries have risks. The risks are small, and we would never advocate to you to have a surgery if the risks of getting it were higher than the risks of doing nothing. So the risk of doing nothing is the risk of doing the surgery is always much less, okay? So one of the risks is bleeding. Another is infection, anesthesia, injury to adjacent organs. Let's go through some of these. Usually these surgeries, you have very minimal bleeding, teaspoon, tablespoon, but sometimes you can have more bleeding. If you do have enough bleeding, you might need a blood transfusion. Blood is very well screened. The risks are very low. There is a small risk of getting hepatitis or HIV. Those risks are 1 in 2 million and 1 in a million, but can vary and change over time. But the take-home message is they're small but never zero. There's also other risks of transfusions. Too much detail for the purposes of this video. There's a risk of infection. Depending on the type of the surgery, you may or may not get a preventative antibiotic, depending on your risk factors. We use a sterile process. We prep the area, their skin, we clean it off to help prevent an infection. Again, that's a small risk for a laparoscopy, but non-zero risk. There's the risk of the anesthetic. It's, again, the medicine we give you so you're asleep, so you don't know that you're having the surgery. It allows you to relax your belly. Those risks depend on your health and your risk. So things that adjust the risks are your weight, if you're overweight, whether or not you smoke. So really, we encourage you to avoid smoking. Never smoke, of course, but around surgery time, a couple of weeks before and a couple of weeks after can dramatically reduce your risks of infection, can reduce the risk of blood clots. So deep vein thrombosis is a blood clot in your legs, or pulmonary embolism, blood clot that goes to your lungs. Very low risk with laparoscopy, especially the shorter time of the surgery, but your risk factors modify things. Your age. As you get older, your risks of surgery go up. There's a risk of injury to adjacent organs. That means when you put sharp instruments near the human body, there's a chance some will get cut or injured that wasn't meant to. It means doctors are human, errors occur. Things that can get injured are bowel, blood vessels, bladder, whatever organ we're working near. Again, general overview, not exhaustive. You certainly will be getting this kind of information from your provider. We're giving you a ballpark education here. So once you have the surgery, this category of surgery is usually outpatient. You usually go home, again, tailored by your risk factors. And generally speaking, you'll have small little incisions. The bigger they are, the more the discomfort, and the longer it'll take you to heal. But generally, I use 5mm ports, but sometimes if we have to remove something like your tubes, it might be an 8mm, or if we're taking ovaries out, it might be a 12mm port, or even larger if we need to keep those ovaries intact, meaning not break them into small pieces. But generally, it's outpatient. and then you'll need to take it easy for a few days. So if I tie your tubes, for example, I generally do them on Fridays, and by Monday, I tell my patients they can generally do most of what they would do, but I certainly wouldn't enter into like a 5K run that soon. If you're not doing heavy lifting, if you're doing secretarial work, or you're doing phones, or you're doing administration where you're just pointing fingers and not lifting anything, then that's the type of thing that you could potentially do just a few days later, but it might even take you 7 to 10 days to recover. Everybody's an individual, and your case is an individual case as well, and whatever information you get, it's an approximation. But hopefully this gives you a ballpark understanding of some of the risks and also some of the timing, but you really need to get all that information from your physician and look at your instructions. Be sure you have instructions beforehand, that you're clear on what's going to happen and what to expect, and also discharge instructions. You will be provided with it on detailed things to watch for, like, do you get fevers afterwards? Are you having nausea and vomiting? Are you having severe pain? You should be getting something for pain, or some plan for pain management. But if it is beyond what is expected based upon the information you're given, that's when you need to contact your provider right away. Fever, like from an infection, or that could come a couple of days later, or nausea and vomiting that could come immediately from the anesthetic or later from some kind of injury. So those are some of the things to watch for. You'll have all of these instructions. This is more to give you just a base foundation again. So I hope you found this helpful, and please leave feedback. Thank you.